Hi everyone, this is my first lecture in general surgery that is about the cholelithiasis. So today I will talk about the cholelithiasis. So that lecture will be divided into 3 to 4 videos. So you can watch all the videos, then you will understand what is cholelithiasis. So in general surgery, so first topic will be cholelithiasis. So actually what is cholelithiasis? So cholelithiasis is the presence of stone in the gallbladder. So when the stone in the gallbladder, we label the patient as cholelithiasis. So it came from the Greek word chole mean bile, lit means stone, and iasis mean process. So it's a process of the stone formation, like in the kidney, like nephrolithiasis. So nephrolithiasis means the stone in the kidney. The stone is formed from the is a process. It's not like just that in the one day stone will form. It's like a process. It will take time to form. So if gallstone migrate to the duct of the biliary tract, so this condition is referred to as Polydocolithosis. When the stone in the common bile duct, we label the patient Polydocolithosis. And when the stone in the gallbladder, we label the patient cholelithiasis. So it's uncommon in children but young adult, but become more prevalent when age will be increased. So age increase, incidence will be increased. So before starting, I would like to present you a case which helps you to understanding the cholelithiasis. So case is about the patient is 57-year-old. Age is increased. See, age is increased. Old woman admitted to emergency with the right upper quadrant pain and tenderness with positive Morphe sign. So that positive Morphe sign showing is a clinical diagnosis of the cholelithiasis. What is positive Morphe sign? Actually, when you palpate the patient right hypochondriac region and you ask the patient to inspire, when patient inspiration, so during inspiration, inflamed gallbladder touches the abdominal wall, so, and that abdominal wall, when touches the abdominal wall, and that place your finger is placed, so patient feel pain. So this is a positive Morphe sign during inspiration. And ultrasonography demonstrate large and thin wall gallbladder. See, gallbladder is normal, there is no inflammation, but might be possible there will be a stone. Why? Because this positive Morphe sign give us an idea about the cholelithiasis. Because or when someone have cholecystitis, stone in the cystic duct, so Morphe sign can also be positive. So that Morphe sign give us an idea about something in the gallbladder, and the stone can be in the gallstone, in the bladder, in the gallbladder, or can be in the cystic duct. So this is about the case. So I will after this my lecture, after this discussion, you will understand, you will know how to diagnose. So this is just like a case in which I will just would like to give you idea about how to diagnose the condition. So this is about the basic anatomy of the biliary system and gallbladder. So this is a gallbladder, and this is a cystic duct, and this is a right hepatic duct, and this is a left hepatic duct, and this is a common bile duct. So if stone present here, we label the patient cholelithiasis. When the stone present here, we label the patient acute cholecystitis. So when the stone in the common bile duct, we label the diagnose like Polydocolithosis. So when the stone present here, for example, when the stone present in here, we do a surgery, either laparoscopic, either open. Or when the stone in the cystic duct, we will not do operation. Why? Because if you surgeon do the operation, so that stone can be passed into the CBD, common bile duct. So when the stone in the hair, so there will be acute cholecystitis. So we patient treat as in the medical, according to medical department, medical case, we will first of all we will decrease the inflammation. When the inflammation will decrease, we will treat patient medically, and when the inflammation is reduced, the stone come back into the gallbladder, then we will electively do the, after 3 to 4 weeks, we will do what operation. So after inflammation settle, inflammation due to stone in the cystic duct, So after inflammation settled, then when the stone come into the gallbladder, then we will do the operation. Or if the stone in the CBD, so we will not do elective laparoscopic or open, then we will order the patient ERCP. In the ERCP, we will pass some tube from the mouth, they come to a duodenum and they go into the CBD and they take out the stone from the GIT tract. So this is about the basic anatomy, that how the stone present and how the biliary system is formed. So this is about the physiology of gallbladder. So in my next lecture, in my next video, I will talk about the physiology